If you're considering dental implants, then chances are you might have heard that you need a bone graft. And there's a lot of different types of bone grafts available. In this video, I'm going to talk about 3 of the most common types of bone grafts that I use, why we use them in certain situations, and the advantages, disadvantages of each one. So my name's Gus, I'm a cosmetic and implant dentist based near London in the UK, and every single day we see patients who need a complete smile rebuild. Okay, so we do everything. My focus is a lot on the surgical aspect because it's the most difficult and I find it the most enjoyable. And in a lot of cases, our patients have had gum disease and we need to do some kind of bone grafting. So gum disease reduces the amount of bone, and even just removing a tooth will cause bone shrinkage. And if you want to replace that tooth with a dental implant, quite often we need to rebuild the bone so that we've got bone all the way around our new implant, because we know that improves our implant success. But also we might need to increase the bone to improve the aesthetics. This is way more important for teeth which are visible at the top, especially if you can see the gum line. So there's a number of reasons we might need bone grafting, and there's probably 3 common ways or techniques that I use to rebuild bone. Number 1 is using animal products. Okay, so people have mixed feelings about this, but the truth is it's tried and tested and we know it works really, really well. And it's very convenient. So the way this works is we have bone products ultimately, usually from bovine, from cows, but we can get it from other animals, and we can also get it from humans. And some people are really funny about the fact that we get fake bone from humans. Okay, so it's not fake bone, it's bone that has been sterilized, cleaned and packaged, and when it comes to us it almost looks like white sand particles. Now the way we use this stuff is we put it on the bone. So usually we open up the bone and there's kind of a hole or a defect, as we call it, which needs filling up with bone. So we'll pack this kind of sand product onto this bone, and then we'll put a membrane on there, which the membrane ultimately comes from pigs usually. And we'll put this membrane over the top of it and tack it in position. When I say tack, we use tiny little drawing pins just to hold it in position. And then we close the gum over the top. Now what happens is the way that this turns into own bone is that your own bone will grow into the gaps between these sand particles. And over time, this area which was all this fake bone, the fake bone acts like a scaffolding and your own bone grows into that. So then we have a nice thick piece of bone where we can place our implants. Now, using purely animal products or products like this, there is a limitation on the amount of bone that we can get. You see, the first thing that has to happen is that blood vessels has to develop into this graft material. And then once we've got a blood supply, then all this healing can happen. But it seems from studies that there's a limit of 3 to 4 millimeters that blood vessels will grow into this bony material. So that limits the amount of thickness or the amount of height that we can achieve with this technique. But it has some really important advantages which we can't ignore. Number 1 is it only involves one surgery. Okay, so when we're doing a bone graft, if we're treating the front tooth, we only need to numb up and do surgery on that front tooth. It's very convenient. We get the material in a bottle and we pack it where we want to go. And sometimes we don't even need that bigger graft, so we can put the implant in, do this bone grafting and close everything up. All the surgery is done in one go. It's really neat and tidy and convenient. And anything that saves clinical time, even though this product costs a bit of money, if it saves clinical time, ultimately it's going to be a less expensive treatment for the patients. So those are the key kind of advantages. It's really good where we've got small defects that we need to correct in a quick and easy fashion. That's why this is probably the most common type of bone grafting that we do. Now, the second type of bone grafting is similar in principle, but we can use completely non-animal products. Now, historically, these haven't worked that well, but recently, for 1 or 2 patients so far, I have started using a completely synthetic product, and it's calcium hydroxide based, and there's a lot of clinicians, especially in the UK, who are using it, and they say really good things about it. And these are quite prominent guys in the industry. So I've started using it. Of course, it's going to have its limitations. I think it's going to be very similar to using the animal product, but a lot of people are not 100% comfortable, maybe for religious or ethical reasons, or just knowing that they've got some other human's bone inside their head. Okay, for some people, this is really, really important, and we can't ignore it. So these synthetic products are promising a lot, and I really hope that they work, because it would be a really neat alternative. Now, the third type of bone grafting is the least common, but it's probably the best type. And this is using the patient's own bone. Now, if you've done any research into this, you may have found articles or people saying that they can take bone from the hip or the rib and transplant it into the mouth. Although this is possible, this is kind of old-fashioned, and I have never ever had the need to do this. And also, this would be a hospital procedure. There's no way this can be done in normal practice. More typically, what we do is we take bone from the back of the jaw, maybe from the chin, and we'll take that bone and fix it where we want new bone to develop. And there's a number of techniques. One technique is one that I use very commonly, and it almost is like I'm using a shaver on the bone. Okay, and don't switch off just yet. Let me explain. What we do is, if we can shave little bits of bone from the back, and it sounds horrible, okay, I appreciate that. What we end up is almost with that bone sandy product, for which I mentioned earlier, which we get from animals. We get that, but it's all your own stuff. It's got your blood vessels. It's a live bone. And we put it in a pot, and then we move it to where we want the new bone to develop. Okay, it's got all of your growth hormones. I think it's got like 42 different growth hormones, which are specific to yourself. Our chances of rejection are very little, and even if we get a complication like the wound opening a little bit, there's a lot more flexibility. It takes a lot more for a bone graft like this to become infected. And there's been situations in the past where we've used mainly a patient's own bone. We've had the wound open up a little bit, and we lose a bit of the graft, but the majority of it is still there. Okay, so this is probably my favorite type of bone graft, just because the success rates are high, and the chances of complications, or if you get a complication, the consequences are less. Okay, now there are also more complicated techniques that we can do, and take a little plate of bone and fix it where we need it to be. These are really great when we need to increase the bone by quite a lot. Okay, when I say more than 5, 6, 7, 8 millimeters. Okay, you can really achieve a lot with this kind of bone graft. So if it's so good, why don't we do this all the time? And again, it comes down to the need in that clinical situation. So if we've got a tiny little defect, it's so much easier just to use one of the other bone grafting techniques. With this technique, we've got 2 wounds immediately. We've got the donor site where we're taking the bone from, and then we've got the recipient site where we're putting the bone to. And okay, this is a photo of someone who we did this for, and you can see it looks a little bit Black & Decker. You know, we've got screws holding these plates all in position, and it obviously is going to cause a lot of swelling and discomfort afterwards as well. Okay, so expect a week of downtime with this kind of bone graft, but the results are really good. Also, because we've got 2 sites, it's almost twice the amount of surgical time. So this is probably the most expensive of all the types of bone grafts that we do. So you can see why we don't use it all the time. It's kind of just like overkill. Now, a lot of clinicians in the UK will not do this third type of bone graft. It's technically it's very challenging to do, and if you're not doing this surgical kind of this complex surgery all the time, then it might be outside someone's comfort zone to kind of be doing this kind of stuff. So the number of people who do this is less. And I'm told that from my implant reps who I work with, that this kind of technique is not so common in the UK. I do it, I know other people who do it, but it's much more common in other countries. And I don't really know why that is, because I think it is a fantastic technique. Yes, it's difficult, but so is anything the first time you do it. So, you know, with practice and just learning good techniques, I think any surgeon is able to provide this kind of treatment. Now, one thing to realize with any bone grafting is that there is always going to, or most of the time, there's going to be some level of shrinkage. Okay, so when we do the bone graft, it looks fantastic, but over time, 3, 4, 5, 6 months, the bone is going to shrink a little bit. So typically what we do is if we're doing the bone graft and the implant on a separate occasion, we'll do the bone graft, let it shrink a little bit, and then put our implant in, and then we will do a mini bone graft at that time. And quite often we'll use the kind of the animal product bone at that time, again, because it's quick, easy, and simple. And most people are okay with it. So if you need implants, if you need bone grafting, there's a number of different bone grafts available, and there might be other techniques which I've not spoken about, but your surgeon swears by, and if they're getting good results, you know, go with that recommendation. One thing I will say is that don't be afraid of this procedure. It sounds horrible, and I've probably put you off it by showing you some clinical photographs, but in the long term, we're looking to achieve a good set of healthy, long-lasting teeth, you know, with dental implants here. And this is literally maybe 2 weeks of discomfort. Okay, the actual procedure itself should not hurt. You should be really numb for that, but afterwards you can get swelling, bruising, discomfort, and this can last a couple of weeks. But then after that, the healing just takes hardly any time. Oh, one thing I forgot to mention, if you were using your own bone, the healing time is dramatically reduced. Okay, if we do one of these really complicated grafts with the bony plates and everything, typically after 4 months we're able to place implants. Okay, this is a crazy reduced amount of time. I mean, there is another option. If we mix the fake bone with your own bone in maybe a 50-50 mix, something like that, we can do that and get really great results, because we get the blood vessel development from your own bone mixed with the fake bone to give us large amounts of volume. But even if we do that, it's going to take about 9 months of healing before we can place implants there. If we use 100% your own bone, if it's possible in your case, then the healing time is dramatically reduced to 4 months. I typically wait 5 to 6 months because I want to be extra sure, but some people do put implants in after 4 months. So you can see there's a number of different ways to rebuild bone. All these techniques have their advantages, disadvantages. Everybody's situation is different, so it's up to the clinician to really choose the best technique to rebuild the bone so that you can have implants and get the kind of result that you're after. So as always, guys, I hope you found this video useful. If you did, please consider giving me a thumbs up. You can subscribe to the channel if this kind of stuff interests you. I do try and shed light on these procedures and everything else that we do cosmetic dentistry wise. Okay, guys, until next time, take care.